Integrative oncology is the provision of care to people living with cancer that incorporates both conventional medicine and also other types of therapies, including complementary medicine, that tries to reach out to all aspects of the person.
Integrative oncology is the combination of the best therapies that are based on evidence from both conventional medicine, which is what your doctor is providing to you, and the therapies that come from different paradigms of care. So from naturopathic medicine, traditional Chinese medicine, from herbal medicine, you see a combination of those two therapies so that patients are able to receive the best care that's evidence-based, no matter which paradigm of care developed that therapy or used that therapy.
Integrative oncology looks at patients as a human being, not just as a tumor or a tissue. So we have to work with a multidisciplinary team. Some address on shrinking the tumor, getting the tumor out of the body. Some address on the psychological issues and spiritual issues of patients. Some address the quality of life problems. So by its very nature, many people from different disciplines have to work together and communicate well together for patients to get the best outcome.
Being involved in psychosocial cancer research, I found in my surveys and interviews with cancer patients very quickly that they wanted to have access to this type of complementary treatments as well. Why? Well, because the treatments, the mainstream conventional treatments, are not always easy on people to take. They deal with the cancer, they have lots of side effects, and cancer patients started realizing that there is more than a cure. If a cure is available, there is also well-being and there is living with cancer. And cancer survivors need supportive treatments as well to make it possible for them to live in a way that deals with their symptoms, deals with their fears, and deals with other issues that they may be dealing with after the cancer period.
The interesting point about this is that we've actually learnt a lot in integrative oncology from palliative care. The patient consisted of more than just a physical body, that there was a mind and particularly spirit involved. And the early philosophy of palliative care, which continues to this day, has a lot in common with the philosophy of integrative and holistic care, which really evaluates every facet of the patient, how they fit into their environment, and also looks at ways to relieve their symptoms so that their quality of life is maximized no matter what the challenges they have with their illness.
15 years ago, we founded Inspire Health before these concepts were mainstream. But patients came to us. We founded it for patients, really. Patients were really searching for, longing for these kind of ideas of support when they were going through the challenging time of a diagnosis and treatment of cancer. The Inspire Health model has been successful because we've provided patients with what they've been searching for, which is a place that they can come to feel empowered, to feel engaged, to feel like they're coming home to themselves in their care. That's as important as treatment is, which is powerfully important in the treatment of cancer. That reconnection to oneself and one's own healing and health potential is equally as important, and sometimes even more important in the context of terminal disease, where patients are healing profoundly, even though physical healing doesn't occur.
It's not just chemotherapy or surgery or radiation or good nutrition. There are lots of other ways, and integrative oncology in particular seeks to unite that, to bring it together. That's what sets it apart. Everyone's trying to treat the whole patient, but sometimes to treat the whole patient you have to invoke other arts.